Hi, Sarah. So your labs are showing us that you might have something called iron deficient anemia. So let's talk about what that is. Anemia occurs when your body does not have enough healthy red blood cells to carry adequate oxygen to your tissues. There are several types of anemia, but in your case, you are what we call iron deficient anemic. Iron deficient anemia occurs mostly in women between the ages of 20 and 49, also young children, and of course the elderly. Iron deficiency can occur because of decrease in intake of iron, which could be because of diet or lack of appropriate vitamins. Could also be because decrease in iron absorption, which can occur also in diet and in gastrointestinal illnesses. Or due to blood loss, like menstruation, gastrointestinal bleeding. We're able to know when you are iron deficient anemic because of blood work as well as several symptoms. The blood work we're looking at is a CBC or complete blood count, serum ferritin, serum iron, transferrin or TIBC, and transferrin saturation. Based on these levels, we can get a better idea of how to create your plan of care. So in your case, your labs were, the hemoglobin was 9.0, which is pretty low. Your hematocrit was 28%, also low. Your serum iron was 30, which was also low. Your total iron binding capacity, or your TIBC, was 450. That was within normal limits. Your ferritin was an 8, which was considered low. And then your reticulite count was 1%, which is also within normal limits. So let's talk about how it affects your lifestyle. But based on your blood work, it tells us whether or not you're at a critical level or not. You're not at a critical level, but we do want to keep track. Many people are not even aware that they're iron deficient anemic until their blood work is completed or they visit a doctor due to symptoms. Based on the symptoms is how it affects your lifestyle. So let's talk about those symptoms. If you are symptomatic, you might feel fatigue or unusually tired because the body's not getting enough oxygen. Your skin might also be more pale in the face, inner eyelids and nails. You might be feeling some shortness of breath, more so during physical activities. Some other notable symptoms could include dizziness or lightheadedness, headaches, restless leg syndrome, cold hands and feet, brittle nails, hair loss, and even something called pica, which is a craving for non-nutrient things, especially something called, crushed ice. A lot of anemics like crushed ice or crave for it. So you're probably wondering if genetics are involved. There are genetic disorders that can affect iron absorption, transport, and storage, leading to iron deficiency. There's genetic variants that can determine how effective a person can absorb and utilize iron. Genetics can also influence diet and health, such as diseases that people are predisposed to, such as celiac disease or Crohn's disease, which interferes with that absorption of iron. So it's really important that we discuss your family history, your current diet and nutrition, because these things are especially important when we're discussing iron deficiency anemia. So you're probably asking if diet and nutrition can help. Absolutely. There's a significant relationship between diet and nutrition and iron deficiency anemia, in that dietary intake and nutritional status play an important role in maintaining your iron levels and decrease any symptoms you may be having. For example, there's something called heme iron. These kind of irons comes from animal meat. So that's the type of iron we want to consume. But there's also things called non-heme iron, which are plant-based foods. So let's get some examples. Obviously, your animal meat is red meat, poultry, fish. Your plant-based foods are lentils, beans, tofu, spinach, or even fortified cereals have iron in them. It's the lack of deficiency in iron-rich foods that leads to the anemia. So if you are vegetarian, some better sources such as vitamins or supplements, they might be highly recommended. It's also very important to understand that malnutrition and eating disorders or lack of diet can, of course, lead to poor iron intake.